Hello everyone, I'm Dr. Tushar Mehta. I'm an orthopedic surgeon and your faculty of orthopedics for PG aspirants as well as for the postgraduate residents. Well, before I proceed, I just want to use this opportunity to share with you all that I've come up with an app called as OrthoBuddy by Dr. Tushar Mehta. It is available on your Android as well as the Apple phone, so it is there on the Google Play Store as well as the iOS. So go and download this app for the amazing orthopedic content, which will help you in preparing for your the DNB, the MS, or if you're doing a diploma orthopedics, it will be really helpful for you not only for preparing for your practicals, for your clinical acumen, but also for your theory exams because it has all the written notes as well as the solved previous 10 years. Well, now coming to the topic, this is about this famous radiology spotter that we all can appreciate here. That's what is called as the triple deformity of the knee. Well, before I go further, I would like to mention the most common cause of triple deformity in the knee that we see in India. Of course, most of you must have guessed it right by now. It's tuberculosis. So the most common cause of triple deformity of knee is always the tuberculosis. But believe me, there are other causes as well. And a very interesting thing that all other causes can be remembered by this mnemonic called as triple. Now, when I say triple, what does that mean? So when I say triple, that means T, again, we've already spoken about that. That's tuberculosis. So what is R? R is rheumatoid arthritis. What does R stand for? Rheumatoid arthritis. What does I stands for? Iliotibial band contracture. What does P stand for? Poliomyelitis. What does L stands for? Low clotting capacity. E stands for excess bleeding, hemophilia. So the causes of triple deformity can be remembered by this mnemonic called as triple, where T stands for tuberculosis, R for rheumatoid arthritis, I for irritable band contracture, P for poliomyelitis, L for low clotting capacity, and E is just like low clotting capacity. It is excess bleeding called hemophilia. Now coming back to the triple deformity, why do we call it a why do we use the word triple? Because it has three components. What are those three components? We'll talk about them one by one. The three components that we have here, the first component is a flexion deformity at the knee. The first component is a flexion deformity at the knee. The second component that we have is a slight posterior subluxation of the tibia. And the third component is an excess external rotation and slight valgus at the knee. So the three deformities are flexion deformity at the knee, the posterior subluxation of the tibia, excess external rotation, and valgus at the knee. I'll talk in a very brief. This is a very small video, so in a very brief session, I'll talk about one by one. So first of all, deformity that I said was flexion deformity at the level of knee. Why? Please try to understand that this is a very well-known fact in anatomy as well, that the most comfortable position of knee joint is 30-degree flexion. Why? There has to be a reason for everything. So why knee is supposed to be the most comfortable position of 30-degree flexion is the most comfortable position of the knee joint, because in this position the capsular volume of the knee is maximum. So since it being the most comfortable position, since there is the maximum joint space, since there is the maximum capsular volume, so that is why, because of the chronic synovial effusion, I repeat, because of the chronic synovial infusion, tuberculosis, it's a chronic problem. It's a problem which usually involves the synovium initially. So chronic synovial effusion is the reason why the patient, the person, the human has a tendency to take the knee in the most comfortable position where capsular volume is maximum, and that is precisely 30-degree flexion. So now you know not only about the first component of the triple deformity, which is flexion deformity of the knee, you know it's 30-degree. Why? Because of the chronic effusion. Why? Because of the most comfortable position and the capsular volume being maximum. The second deformity, if you remember, I told you that there is slight posterior subluxation of the tibia. I have to talk about it. But before I talk about it, I want all of you to know, because I hope that all of you know this. Again, everything, orthopedics is nothing but an application of anatomy. So normally we all have a posterior tibial slope. In a normal knee, there is a slight posterior tibial slope. In a normal knee, there is something which is what we call as normal physiological valgus. So we all have a normal physiological valgus along with a normal posterior tibial slope. So think about it. If there is a chronic disease like tuberculosis of knee, is it a destructive disease? Yes. So if it is a chronic destructive disease, then don't you think it leads to somewhere subluxation of the joint? Yes. And that subluxation of the joint will do nothing but exaggerate. It will do nothing but exaggerate the excessive. It will do nothing but exaggerate the normal physiological alignment that we have. So, what is a normal physiological alignment? The posterior tibial slope. So, any chronic destructive disease like tuberculosis will exaggerate this normal posterior tibial slope, and that exaggeration of the normal posterior tibial slope will lead to posterior subluxation of the tibia with respect to femur. The normal physiological valgus will be exaggerated and you will have an excess valgus, and that for where I can explain my third deformity. If you remember, the first one I said was flexion deformity at the knee, the second one I said was posterior tibial subluxation, and the third one I said was excess external rotation on valgus at knee. So excess external rotation or valgus at knee is basically nothing but an exaggeration of the normal physiological valgus that we all have, and that exaggeration happens due to a chronic destructive process like tuberculosis. I hope that makes some sense to you. So now I would like to make mention of something here, that this triple deformity has a very slight modification. Then sometimes it becomes a quadruple deformity. Sometimes it becomes a quadruple deformity, and when we call it a quadruple deformity, then nothing, an extra genu valgus is added to that. But that's of not of much of the clinical significance. The clinical significance coming back is triple deformity. It has three components: flexion of the knee, posterior subluxation of the tibia, excess external rotation or valgus at the knee. We have spoken about the reasons. We have spoken about the causes of triple deformity, tuberculosis being the most common. So I hope you are able to remember, understand that not only the three components of the deformity, but the reasons behind these deformities are happening. And this is a famous radiology spotter, a Viva question. And I wish you all the best, and do subscribe to the app. As I said initially, also it's OrthoBuddy by Dr. Tushar Mehta, available for both Android as well as the iPhone. And apart from this, do watch out one more video on tuberculosis of knee. Of course, that's a larger video where triple deformity is also a part of that video. So wish you all the best. Thank you so much. God bless.